Next is the external validity, and we had defined external validity previously as how generalizable the results are. And if you remember, we had discussed that in experimental studies, the more you put constraint on the study to control it, to make sure that you have a very good internal validity, the less you can generalize your results. Therefore, one of the issues that you have to think about when you're discussing external validity, the generalizability of the results, is sampling. We're probably going to have a lecture about sampling where we're going to talk about the different ways you sample and the different techniques and approaches of sampling. But nonetheless, I think we can say at this time that a representative sample will be maybe like the first good step for generalizability of the results and therefore a representation of the population. But I'm going to introduce a few words here, and the words are population versus samples. You probably are aware that a sample is a subset of a population, and a population is all the elements that have certain characteristics under study. If you're studying diabetic patient, then your population are all diabetic patients. If you're studying, مثلا, you want to know if your drug works on hypertensive people, then your population is hypertensive people. But we differentiate between the target population and the attainable or the accessible population. I'm going to give you the simplest example. If my target population, if I want to target, let's say, um, if I want to survey, let's say, the Lebanese population, that's my target population. I want to do a survey. I want to talk to the Lebanese population. That's my target population. Anybody who is Lebanese living on Lebanese soil. Well, if I design my survey so that it's done through telephone, so I'm going to do a telephone survey, the accessible population are those that I can reach using my methodology, yani those that have a phone. And therefore my target population in all the Lebanese people, whereas the accessible population, the attainable population would be those Lebanese with, let's say, a mobile phone. That's one nuance between target population and accessible population. If you want to study, let's say, if I want to do a survey about children in Lebanon, and again, so my attainable population would be children in Lebanon. My accessible population could be, if I go through schools, for example, then children that are schooled or going to school. Your best scenario would be if your accessible population is as similar as your target population. Hello, in generally speaking, your accessible population is part of your target population. The more your accessible population, your attainable population covers your target population, the better it is. And so that's the first thing is who's your target population and how are you going to get to your target population? Therefore, what is your accessible population? And then you have to think about your sample size and your sampling techniques. Sample size and sampling techniques, we will address them in a different lecture that will come to in this course. But suffice now to say that for external validity and generalizability, we have to think about who's my target population and how am I going to get it. Yani, what is my accessible population? And you want to make sure that you get enough people in your sample, and your sample size has to be big enough. And you have to think about what is my strategy of getting these people, what is my sampling technique. The last thing we're going to discuss in today's lecture is something called confounding. Now, you heard me talk about confounding previously when I introduced the different types of variables. I said we have dependent variable, which is the outcome. You have the independent variable, which is your exposure. And then you have a confounding variable. And a confounding variable is a third type of variable that has certain criteria that it should meet to be able to consider this variable as a confounding variable. So what is a confounding variable? Well, let's first say what are the criteria for a variable to be considered a confounding variable, and then we talk about what is a confounding variable. For a variable to be considered a confounding variable, it has to be related to the independent variable. It has to be related to the independent variable, and it should not be in the causal pathway of the independent variable. Yani like the figure you have here is showing. The confounder is related to the dependent variable, it is related to the independent variable, but it's not in the causal pathway like in this figure. So here you have your exposure, you have your disease, you have your confounding variable. Okay, now your confounding variable is associated with your exposure, associated with your disease, but it's not in between. Whereas here you can see that the exposure leads to the confounding variable, and therefore the confounding variable leads to the disease, and therefore this variable in the middle is in the causal pathway and should not be considered a confounding variable. Rather, I think we refer to it as a mediating variable. It mediates relationship between the exposure and the outcome. So what is a confounding variable? A confounding variable is a variable that affects this relationship between the exposure and the disease. It alters it. It alters it by either by making it weaker. So there could be a relationship between the exposure and the disease, but the confounding variable is erasing it, making it as if it does not exist. It could be that it could do the total opposite, where you have an exposure and have disease that are unrelated, but the confounding variable is making it as if they are related, uh, or anything in between. And a confounding variable can make a relationship appear stronger or it appears weaker. So a confounding variable can do any kind of thing to the relationship between the exposure and the outcome. And we're going to discuss examples in the next video.